Hi, we are Team Ninja. My name's Ramal,
And I'm Leja.
and we are from the University of Auckland in New Zealand.
The company we have chosen is Fisher and Paykel Healthcare because one of the cornerstones of their operations is continual innovation in their products through research and development. The company's philosophy centers around improving quality of life for users of its products. There are two main categories of products: respiratory acute care, which includes apparatus to administer gases for therapeutic, surgical and neonatal treatments, and obstructive sleep apnea products, which are used to facilitate breathing during sleep for those who suffer from the disease. Fisher and Paykel have got two manufacturing facilities in New Zealand and Mexico. Their largest market is the US, and the plant in Mexico was established due to its proximity to this market. There are three tenets to Fisher and Paykel Healthcare strategy. They are 1. Innovative medical devices, 2. Continuous product development, and 3. Improvement of global respiratory healthcare. At the heart of shared value is the relationships that exist between shareholders, the community, and the environment flowing through to a business's operations.
Our initiative is called Learn, Create, Grow, which mirrors the stages of implementation. Learn looks at immediate 1 to 2 year period. First of all, Fisher and Paykel must undertake market research in developing nations such as Mexico and Latin America in order to have a good idea of the legislative landscape and infrastructure available to support our operations. We define developing markets to mean those with a lower standard of living, underdeveloped industrial base, and lower human development index relative to other countries. Central to our recommendation is creation of a cultural awareness group that will work closely with communities to understand the value they place on component parts of a product. Through a process of design to value, a tool which analyzes each component of a product, Fisher and Paykel can begin an era of co-creation.
Create looks at the medium 4 to 10 year period. We want to position sales, legal, and CAG teams in Mexico who will craft relationships with key stakeholders such as governments and NGOs. Then, the initial product testing phase will begin to ensure compliance with local legislation. Through local engagement, we will get a good understanding of the value placed on healthcare products. Fisher and Paykel Healthcare can begin to manufacture products catered to the Mexican market. Furthermore, we will add value through capitalizing on education and support structures. We advocate for the creation of a hybrid distribution network, where Fisher and Paykel Healthcare teams will be placed in markets to work in partnership with distributors and continually provide feedback. Finally, we recommend the use of two key performance indicators which tie in back to our view on shared value. Firstly, we have exposure by using the number of units per medical clinic. Secondly, we have growth of profit in targeted markets to continually assess investment needs.
Grow looks at 10 years and beyond. Having created a strong foothold in Mexico using shared value, Fisher and Paykel Healthcare should seek to further integrate and implement this method of thinking into other Latin American markets. In the future, Fisher and Paykel Healthcare can look at implementing other aspects of shared value through examining its supply chain. Again, continually track and assess progress using KPIs.
Risks for the initiative fall into three categories. There are operational risks, such as having to comply with legislation in each region and potential timeliness issues with regards to customer orders. There are also strategic risks, such as not understanding a market's culture and how they prioritize healthcare compared with the markets in which Fisher and Paykel Healthcare currently operates. Finally, there are financial risks, such as currency fluctuations and expansion risk.
There are several beneficiaries to our proposal, including the wider community. Through consultation with communities, we can better understand their needs and engage in a process of value co-creation, consequently improving access to our products. Existing businesses and NGOs. Through engaging with local businesses to create a hybrid distribution model, where both parties can mutually benefit, and working with NGOs to address awareness issues. Fisher and Paykel Healthcare. Employees can be motivated, and as the company experiences growth, there are positive outcomes for shareholders. And finally, the government. The health of the general population will improve, and there will be positive direct effects on the public healthcare system.
As we said earlier, at the heart of shared value is the relationships that exist between shareholders, the community, and the environment flowing through to a business's operations. Learn, create, grow. This is how Fisher and Paykel Healthcare can harness the benefits of shared value to achieve its vision of improving the quality of life.